Hi, thanks for joining us for this edition of Medical Innovations here at the Austin Neurosurgical Institute, joined again by Dr. Tom Loftus. Dr. Loftus, thanks for being with us today.
Thank you.
Now, and of course, you specialize here in the latest technology with minimally invasive surgical techniques, but let's back up a little bit. Somebody experiencing back or neck pain, what should they do?
For a lot of people experience a severe episode of back or neck pain at some point in their life. Oftentimes, the initial treatment is simply rest, something called NSAIDs or non-steroidal anti-inflammatories. We think of Motrin, Advil, those types of medications. For a majority of patients, a couple of weeks of rest and anti-inflammatories will resolve. Certainly, if you have back pain that extends beyond that or is too severe to simply manage, the next option is simply to call your physician. Typically, if the back pain or neck pain extend beyond a couple of weeks, the first line of treatment is often physical therapy. Some people incorporate chiropractic treatment. Certainly, if it's not resolving at that point, if we have not already, we get imaging, which will include x-rays and typically MRI to better assess the areas. If there's a finding on the imaging studies that's concerning, that's often when patients are referred to us for further treatment.
And so who would be a good candidate then for the minimally invasive approach that you take here?
Well, the minimally invasive specifically is referring to either microdiscectomies of the lumbar spine or fusions of the lumbar spine. We also use microscopic surgery in the cervical spine, and that's used fairly widely throughout the U.S. now. As pertains to the minimally invasive lumbar surgery, there are typically only a few people in each city or geographic area that actually perform that, and that's certainly what we do here. Good candidates, again, are patients we prefer to have already completed the non-operative. We're very big proponents of trying conservative treatment as a first line if possible. But typically, a patient with 1 or 2 level disc disease, meaning wear and tear in the level of a disc, with intractable back pain and or leg pain, are often good candidates for minimally invasive spine surgery.
Thank you for being with us.